Hi, I'm Dr. Todd Singleton. I'm going to explain briefly on how spinal decompression works and why you're having some pain. This is a vertebra. These are your two vertebrae, and in between here are some discs. Now these discs are healthy. You've got some good cushion in here. But years ago, you probably had a fall. You had an accident. Not that you even went to the hospital with, but the fall and the accident created some instability here, some movement. Now here's what happens. Through the years, these disc spaces start to decrease. The fibers right here on the outside of the disc start to break down, start to wear down. Now again, some back pain, some stiffness in the back, not a big deal. Well, all of a sudden one day you're out in the garden, or you're lifting something out of the car, or you're getting out of bed at a hotel that you're not used to sleeping in. So here's what happens. Within time, the little nucleus in here, with pressure, starts to get pushed outward. And all of a sudden one day it causes this herniated disc, this bulging disc. Here's what happens. When that disc gets pushed out, it starts to choke the nerve. Now that nerve could be in your neck, and it could cause some numbness and tingling and pain in your hands, or it can be in your low back. And what's in your low back, you've heard of the phrase sciatica. It can actually affect the nerve traveling down your leg, causing a lot of pain and a lot of discomfort. I see a lot of this. And what the spinal decompression program is we basically do decompression, which means this. We put you on a table, we put you in these straps, and we're slowly decompressing the spine. So as we traction this spine, we're creating a negative pressure on the inside of the disc. What that's doing is it's infusing, bringing in blood supply, nutrients. And as we create this decompression, it creates a negative pressure on the inside of the disc to help draw the disc back in. And as this happens, it takes pain away and it decreases the inflammation. But if you don't come now and get this treated, then here's what happens. It turns into spinal stenosis. I do see a lot of people who wait until it's too late, typically in your late 70s, 80s, and 90s. But guess what? Even if it's this point in your life, this is going on, I can still help you. So if you'd like to come in for an evaluation, I can show you how spinal decompression works, and we can look at your MRIs, your x-rays that you have, and we can decide what it's going to take to help you. So call the office at 801-265-3400, or you can go to my website at painfreeutah.com, or you can click below the link for more information.